Hi everyone, how are you? It is Dr. Splickle, functional podiatrist, human movement specialist, founder of EBFA Global, and inventor of Naboso. So today we are going to speak about how to activate our pelvic floor in a standing position. Now this is something that we teach in all of EBFA's education. It is something that I incorporate in all of my patients' programming. And the reason why I wanted to do a video on standing pelvic floor exercises is that I get many patients in my practice who are coming to me with chronic foot, pelvic, low back imbalances and find that when they do their exercises to connect to the deep core and the pelvic floor and they're on their back doing, let's just call it Pilates, but they're on their back, doing the awareness and the activation, it's so much easier. And then I get them standing up in gravity with their feet on the ground and I try to do a pelvic floor activation. Many of them find it very, very difficult. And what happens is that when we get so used to doing some engagement with our back pushing into something, almost like at the gym where you have a preacher's chair and you push your back into the back of the chair and you lift your legs, right? So much easier, right? And then if I'm here and I have nothing against my back and I try to do that same thing, oh my goodness, the demands on my deep core are so much higher. It's actually very difficult for many people to do that same exercise when they don't have the bracing or the pushing of the back into the floor or into a chair or a ball or something like that. So what I wanted to do is go over a activation. I will call it also an awareness exercise for the pelvic floor in a standing position. So just like when we're on our back doing a pelvic floor awareness exercise, when we stand up, our first step is to stack our rib cage and our pelvis. So I want you to stand with your feet shoulder width apart, knees are soft, and we want to stack that rib cage and pelvis. If you want to keep your hands just inside the ASIS, so my fingers, I find my ASIS, I go right inside of there, and every time I engage my pelvic floor, I'm going to feel the connection right there. So I'm in this position here. I find my foot tripod, I'm spreading my toes. Perfect. Now what we're going to do is we're going to start to differentiate the front of the pelvic floor with the back of the pelvic floor. The front of the pelvic floor we're going to engage first. This will be like a classic Kegel. This is going to be where we are going to stop our pee, okay? So let's do that first. Starting nice and relaxed, I'm gonna have you engage the anterior pelvic floor itself. So imagine you're stopping your pee and then release. Again, stopping the pee and release. Every time you do that, hold it for 5 seconds if you want, and then release. Every time you do it, you should feel some sort of engagement or tension underneath your fingers just inside your ASIS. So let's do that again. So engage the anterior. Yes, and as I do it, I feel tension or a sensation coming a little bit more anterior. Guess what that is? That is your TVA, which myofascially blends into your anterior pelvic floor. Once we've done that a few times with the anterior, we're going to relax the front and we're going to go to the posterior. So assume that same position, you're still stacked, you're still on your foot tripod, but this time we're going to focus on the back side. So for this, we're going to stop our poo. We are technically engaging the levator ani. So when I engage the back side, I'm going to lift and then release, lift, and then release. Again, my hands are staying here. Lift, and then release. I feel tension under my fingers when I lift my posterior pelvic floor. Perfect. I also feel a little bit of radiation this way when I engage my posterior pelvic floor. It's your first step. Now we're going to add on, and what we're going to do is stop our pee, hold. Stop our poo, hold, release both. So engage the front, engage the back, release both. Technically, it is a lift. So lift the front, lift the back, release both. Front, back, release. Front, back, release. Can you now lift both the front and the back at the same time? So both, release, both, release, both, release. And then technically, if you kind of think about how your breath wants to act, is every time you lift the pelvic floor, exhale, release. Exhale, release. Shh, inhale. Shh, inhale. Shh, inhale. Great. And then if you want to add your feet in, this is what we're going to do, is every time you lift the pelvic floor, you are going to exhale. Every time you lift and you exhale, you push your toes into the floor, and then we relax. So we're going to lift, release, lift, release. Toes down, release. Toes down, release. Shh, release. Shh, release. Shh, release. Beautiful. You want to add one more layer to that if you want. Make a fist every time you do it. Open your hands. Do something. Okay? Here we go. So you're going to shh, release, shh, release, shh, release. I'm essentially building the awareness of the anterior to the posterior. I am building priming of the nervous system. I am sequencing my diaphragm at the pelvic floor with my feet. I'm doing tension stacking. I'm doing neural priming. I am getting the body ready to either stand up in gravity and just walk across the room, or I'm getting the body ready to coordinate foot core stability so that I can train for a sport. I can do my physical therapy exercises. You can incorporate this in many different ways. Again, as a brief recap, why I wanted to do this video is that when I do pelvic floor exercises with my patients, the ultimate purpose is that we need our feet to connect to the core. If you just do short foot and it's not connecting in the way that I just said or taught you when you stand up, we need to take a step back. What's happening with this client or this patient's pelvic floor? Do we need to do focused pelvic floor exercises? Quite possibly. Yes, we start on the floor, but after you do it on the floor for a while, you've got to get that patient or client standing up. As soon as they stand up, do they lose that neuro connection with their pelvic floor? Many people will, so how do we build that in? How do we give them a cue so they can keep that connection? Ultimately, the integration that you want after every reset or optimization of their neural connections is the integration with the ground and with gravity. If you're looking to learn more about how to optimize the pelvic floor pelvis, check out EBFA's Pelvic Balance course. Or if you want to learn more about how your feet connect to the core and apply to dynamic movement, check out the Barefoot Training Specialist, as well as many of our other courses through ebfaglobal.com. Until next time, stay barefoot strong.